it's my honor, really deep honor, to welcome today our main speaker, Dr. Jean-Luc Vigneron, an author of more than 100 publications in English and French journals, a really renowned French dermatologist, and author of numerous presentations at international symposiums and events. So Dr. Jean-Luc was the first to call Gouri shadow hunter, and I do believe that this is a great metonymy that actually describes Gouri and its essential characteristic as a product. So please welcome Dr. Jean-Luc Vigneron.
Okay. I'm very happy to be here to speak about a product really new. It is not a new hyaluronic acid. It is not a volumizer. It is not a filler. It is an inducer, and a very good inducer. You know that aging is a result of interplay of change occurring in the different facial layer, skeleton, ligaments. Okay, you know that, and we act on the superficial layer on the dermis. Here you see that volumize and give a big volume is not a solution to be nice, it's not really a good result, I think, but it is a fashion now. And the new trend is a more natural beauty. Less volume is better. Skin quality is the main point of face rejuvenation, because with this product you have an action on the surface, a little inducer of collagen, and also on the quality of the superficial skin. Botox, you know, it is for the upper part of the face. The fillers create heaviness if you inject much quantity, normal quantity, sometimes we have heaviness. And Gouri is the world's first liquid form of PCL, polycaprolactone. It is liquid, and it is very important to know that, because you have a spreading of the product very easy. And when you touch a point with the product, you have a diameter of 4 centimeters. It's very interesting for that. And for this reason, I gave the name of Shadow Hunter. And you have action, of course, of hydration, of skin firmness too. Here, this slide is okay. You know, everybody knows that. Huh? The superior part of the face, it is for the Botox more, and the fillers, it is for the volume. But there is something interesting. You will see that after on other slide. Je vais trouver ça. Yes. This part, it is always very difficult to treat with Botox, you know, because if you treat too well, you have an action of the smiling. If you inject here the Gouri, you have an action on this part of the wrinkles of the crowfoot. It's very interesting to know. Gouri, it is a liquid polycaprolactone, and you know, you have this type of reaction, of effect. It is, you know, you have spreading. It is not only points, because before Gouri, there was other product with polycaprolactone in vesicle, with inflammation after very often, and also punctual action, not action with spreading like this. And this is a special effect of Gouri. And this characteristic of injectable is really fundamental. We treat here and here, but and the forehead too. But the idea is to treat and to have a preventive action on the aging. Preventive. Here you see the difference between the polycaprolactone fluid and this one with particle, with vesicle. 3S of Gouri. Spreadability is very important to know. I explained you that just before, because when you inject 1 point, you have diffusion, you have spreading. Sustainability, because you have an action for 10 to 12 months. In reality, you have to inject usually twice with an interval of six weeks. Safety, there is no side effects related to microparticle. No compression by microparticle, of course no necrosis, no granuloma, because you don't have solid element inside. Gouri won this award last year, I think. It was really a new concept, really amazing concept. Here you have to understand that it is something new. It is not evolution of hyaluronic acid or of acid polylactic. No, it is new. Clinical data. Here you can see the effect with measurement of cutometer of the action on the crowfit. I know that this slide is not really easy to read, but you have the result with the number. It is proved. Here it is the thickness of the dermis, and you know the 1, 2, 4, 6. You know the evolution for another product and for Gouri. You have really a measurable effect, and when you touch the skin after injection, you touch that there is more thickness. Here you see that cutometer 2, that after 2 weeks, you have suddenly an increasing of the elasticity. Here is the measurement of elasticity. And the protocol is important. You know, here, the cannula used is 25 gauge and 50 millimeter. Me, I use really often 22 gauge and 70 millimeter. I use that to be longer. And I inject always in the deep dermis. You don't have to inject superficially, but in deep dermis. Anesthesia. Yes, it's really useful to do that. You do a point of entrance of the cannula. After you inject on the channel of the cannula, before you inject Gouri, you inject a liquid mixed lidocaine and physiologic serum. And after, you arrive after with your cannula of Gouri, and you make the same way, and you inject. Tomorrow there is a live workshop, okay? You take the same way with you search the aspiration probe, okay? Okay, it is a procedure, official procedure. And in post-medication, if it's necessary, also prednisolone. Really, when I did many injections with Gouri, the reactions are really rare. Okay, here it is to be very careful. No massage, like this, and 1 month break before after using dermal filler. You don't do nothing during. It means 1 month, and a second session is good after 6 weeks. And really, it's done in 5 minutes. Huh? Contraindication, of course, anticoagulant, yes. For me, it's not contraindication because you don't break the vessels. It is with cannula, there is no problem. Of course, immunocompromised patient, autoimmune condition, hypersensitivity, okay, pregnancy, always. There's not really other contraindications that the other product you can inject in the skin. Here it is all the certificate obtained by Gouri. Gouri has passed all the necessary safety testing in all the country. And of course, there is no particles, and then there is no severe adverse events. you can meet this type of secondary effect. There is 2 studies, one in 2018 and one other in 2021. It is exactly the same result. A little swelling, pain during the injection if you don't do the anesthesia. If you do the anesthesia, there is really no pain. Redness, itching. Itching, it is rare. Redness, yes, for 2 days sometimes. Bruising, it is perhaps when you are a little too superficial. Bruising is not really often. But it is very honest to speak about that because it is no more than the other fillers. Okay, the same. Protocol. Now we will inject with cannula. Here you have 2 points of reference. One here, one here. Here it is really often done in Asia. Here more in Europe we don't do many really often this point. But you have to do here your channel with the anesthesia after you do your channel with Gouri, and it is axis, the vector, but you inject until here, not until here. You are until the direction of the nose. You go until here, and here with long cannula you can inject from here to here, with the same by the same hole, and you inject with a retro effect like this, a small quantity. For me, the first session you inject 2 syringes, 1 milliliter by side, and you have a first effect. The first effect is done by the volume of the product and the reaction, but the real reaction, the real effect you can see after 3 weeks, 4 weeks, and when the patient come again after 6 weeks for the second session, you do the second session with only 1 milliliter for both sides, only 1 syringe. First session 2 syringe, second session 1 syringe. Here it is the technique with 1 syringe. It is the same. Me, even I don't treat the forehead, I inject for the first session 2 milliliters, 1 and 1 on the cheeks, on the nose, on this part. Even I don't treat the forehead. And with this simple gesture, it really is not complicated to do, you have an effect really amazing because it is really a shadow hunter. You have a increasing or not increasing, but improvement of the curve of the face without shadow. In this case, the second session, 1 syringe and 0.25. Okay. The first session it is 0.33 by vector. Okay. And now you will see the interval. First session 2 syringe, 4 to 8 weeks. Okay. You understand that. And here you can see a result I did. Here you can see the quality of the skin. Here. Here you can see the beginning of the dermal. The name for me is cushioning action, because when you touch, it is like a cushion. It is soft. The same patient. It is only 10 days, 30 days after the first. You see the difference here, and all the cheek is better. The surface and the quality of the curve. Here it is in white, in black and white, because you see better the question of the shadow. The shadow here, and you see it's imperceptible. When the friends of this woman saw him, what did you do? It's invisible, but you look really, younger, you look healthy. Okay, it's very important. Here, it is always the same question of shadow. These are irregularities in, not after. And now for the neck, is it the beginning of the dermal cushioning action? The effect on the neck needs to be confirmed and protocolized. We try to do that. I think it is really a good experience for the future, but for the moment I don't know exactly the doses, and I do with cannula too. But there is really an effect. Here it is always the action, you know, the face is more, the curve is more regular, the patient look younger. You see, it is not volumizing. It is discrete volumizing on a big area. When you see that, you have always to see well, because it's not if you do cheeks with acid polylactic or so, boom, it is so. No, here it is a general impression. You have an action also here. You see, it is a little hollow here. Here no, but it is discrete. Okay. Here it is a little amazing. Stick was very curved. Here it is to explain that you have also to use this product for very small indication, very when you have a patient who wants details, some complicated things, and it's complicated to answer well. Here you see very, very small effects, very discrete effect, and this part not accessible by Botox. This part is done, you know. It's very difficult to have a good action on this part of the crowfeet. Okay, the PCL fluid Gouri is really advanced in the field of skin restructuring. Gouri blurs shadows. Gouri redensifies the dermis and indirectly smooth the epidermal surface. Gouri spreads and allows a broad action with few entry points. Gouri eliminates the shadows of the face that appear with age. Gouri Shadow Hunter. Thank you very much.